Today's medical-centric topic is excessive burping, understanding causes and effective treatments. Excessive burping can be uncomfortable and embarrassing. Identifying the underlying causes and knowing the appropriate treatments is essential for managing this condition effectively. Causes of excessive burping. Various factors can lead to excessive burping. Key causes include 1. Swallowed air. Eating or drinking quickly. Swallowing air while eating or drinking can lead to burping. Chewing gum or sucking on hard candy. These activities can cause you to swallow extra air. Drinking carbonated beverages. Soda and sparkling water release carbon dioxide gas, which can cause burping. 2. Dietary factors. Certain foods. Foods like beans, lentils, cabbage, and onions can produce gas. Fatty foods. High-fat meals can delay stomach emptying and increase burping. 3. Gastroesophageal reflux disease, GERD. Acid reflux. Stomach acid flowing back into the esophagus can cause frequent burping. 4. Helicobacter pylori infection. Stomach infection. Irritable bowel syndrome, IBS, can cause excessive gas and burping. Gastroparesis. Delayed stomach emptying can lead to bloating and burping. 6. Medications. Certain drugs. Medications like aspirin, ibuprofen, and certain laxatives can increase gas production. Symptoms to watch for. 1. Frequency of burping. Note how often you burp and if it's related to specific activities. 2. Associated symptoms. Look for other symptoms like bloating, heartburn, or abdominal pain. 3. Burping with taste or odor. This may indicate underlying gastrointestinal issues. Treatment options. 1. Dietary changes. Eat slowly. Taking time to eat can reduce swallowed air. Avoid trigger foods. Identify and avoid foods that cause excessive gas. Limit carbonated beverages. Reduce intake of soda and sparkling water. 2. Lifestyle adjustments. Quit smoking. Smoking can increase swallowed air. Chewing gum. Limit chewing gum and hard candy to reduce air swallowing. Smaller meals. Eat smaller, more frequent meals to aid digestion. 3. Medications. Antacids. Help neutralize stomach acid and reduce burping. Proton pump inhibitors, PPIs. Reduce stomach acid production for those with GERD. Antibiotics. Treat H. pylori infections to reduce symptoms. 4. Hydration. Drink water. Drinking water can aid digestion and reduce the frequency of burping. 5. Managing underlying conditions. GERD management. Lifestyle changes and medications to manage acid reflux. IBS treatment. Dietary changes and medications to manage symptoms. Gastroparesis. Medications and dietary adjustments to improve stomach emptying. When to seek medical attention. Persistent symptoms. If excessive burping persists despite dietary and lifestyle changes. Severe symptoms. If accompanied by severe pain, weight loss, or other concerning symptoms.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.